Imagine you arrive at the scene of an overdose. A young adult has just ingested a handful of unknown pills. Time is critical. The clock is ticking. What can you do to stop the poison from spreading in their body? One of the most powerful tools in our EMS arsenal is activated charcoal, a simple yet life-saving intervention in toxic ingestions. So, what is activated charcoal? Activated charcoal is a highly porous form of carbon processed to have a large surface area for adsorption. It is commonly used in medical and environmental applications to trap toxins and chemicals, preventing their absorption into the body. It's not the same as the charcoal you use in your barbecue. It undergoes a special treatment that increases its adsorption capacity. Activated charcoal works by adsorbing a variety of drugs and chemicals, binding them to its surface and preventing their absorption in the gastrointestinal (GI) tract. Let's start with some important information about activated charcoal for the EMS providers. It is time to take some notes. Medication class. Activated charcoal is classified as an adsorbent. Mechanism of action. It works by trapping chemicals and preventing their absorption in the gastrointestinal tract. The standard EMS dose for adults is 50 to 100 grams orally. The pediatric dose is 1 gram per kilogram of body weight, which is typically 25 to 50 grams orally. Here are some of the indications for activated charcoal. EMS professionals should consider administering activated charcoal in cases of toxic ingestions where the ingestion is known to be adsorbed by charcoal. The ingestion occurred within 1 hour. The patient is alert and can protect their airway. Common toxic substances that respond to activated charcoal are acetaminophen, also known as Tylenol, aspirin or salicylates, tricyclic antidepressants including amitriptyline and nortriptyline, beta blockers and calcium channel blockers, to some extent. And finally, certain pesticides. Despite its effectiveness, activated charcoal is not always appropriate. EMS providers must be cautious in the following situations and identify these contraindications. Unprotected airway. If the patient is drowsy, vomiting, or unable to follow commands, charcoal can be aspirated into the lungs, leading to pneumonitis. Always ensure airway protection. Caustic substances. Ingestions of acids, alkalis, or hydrocarbons, bleach, drain cleaner, gasoline, can cause burns to the esophagus. Charcoal does not neutralize these substances and may make things worse. Bowel obstruction or ileus. If the gut isn't moving, charcoal just sits there, leading to severe constipation or perforation. Heavy metals, alcohols, and lithium. Charcoal does not bind to substances like iron, lead, ethanol, or lithium, so it offers no benefit. Activated charcoal works through a process called adsorption, not absorption. Think of it like Velcro darts on a dartboard. It binds to toxins and prevents them from crossing the gut barrier into the bloodstream. Instead of the poison getting absorbed, it stays trapped in the charcoal and gets eliminated from the body. However, timing is everything. Charcoal is most effective within 1 hour of ingestion. After that, absorption of the toxin may have already occurred. Here are some special considerations to think about. If the patient vomits immediately after ingestion, consider re-administering charcoal if airway protection is intact. Charcoal should not be given with sorbitol due to the risk of dehydration and electrolyte imbalance. If transport time is short, it may be better to wait and let the hospital administer charcoal under controlled conditions. Activated charcoal is a powerful yet underutilized tool in EMS for poisoning emergencies. But it requires the right patient, the right toxin, and the right timing. Next time you respond to a poisoning, ask yourself, is the toxin adsorbable? Was the ingestion recent, within 1 hour? Can the patient protect their airway? If the answer is yes, activated charcoal might just save their life. Or if you should forget, remember you can always consider consulting Poison Control 1-800-222-1222 for guidance on whether activated charcoal is appropriate.